Stick out your tongue. Go ahead. Look at it in the mirror. What you see isn't just a random pink surface. Your tongue can reveal surprising clues about your overall health, from vitamin deficiencies to infections, even early warning signs of serious conditions. In this video, we'll uncover what your tongue says about your health, what's normal, what's not, and the hidden signs you should never ignore. Stay until the end, because I'll share one tongue change that could be a red flag for something much more serious than bad breath. Let's start with the basics. A healthy tongue is usually pink, with tiny bumps called papillae. It should feel moist, smooth, and comfortable. Small variations are normal, but big changes in color, texture, or coating, that's when your tongue starts sending signals about your health. If your tongue looks white or coated, it could mean a few things. The most common? Poor oral hygiene. Bacteria and food debris collect, creating a white film. Another cause is oral thrush, a yeast infection that makes the tongue patchy white and sometimes sore. White patches that don't scrape off? That could be leukoplakia, sometimes linked to irritation or smoking, often harmless, but in rare cases, linked to oral cancer. If it doesn't go away, get it checked. Now let's flip to the opposite, a bright red tongue. If your tongue looks unusually red, it could mean a vitamin deficiency, especially B12 or folic acid. In children, a red tongue may indicate scarlet fever, which needs quick treatment. And then there's geographic tongue. Red patches that look like a map. It looks scary, but it's harmless. So redness can mean many things, from minor issues to something more serious. Yes, there's such a thing as black or hairy tongue. Sometimes the papillae grow longer instead of shedding. They trap bacteria, food, even tobacco, making the tongue look black and hairy. It looks alarming, but it's usually harmless, often linked to poor oral hygiene, antibiotics, or smoking. The fix? Better cleaning. And quitting tobacco. What about a yellow tongue? Often it's from bacteria buildup or smoking. It can also result from dry mouth. In rare cases, yellow tongue is linked to jaundice, when the liver isn't working properly. If your eyes look yellow too, that's a sign to see a doctor. But color isn't the only clue. Pain, swelling, or sores matter too. Canker sores are small ulcers that heal on their own. Trauma, like biting your tongue or burning it, can cause soreness. Enlarged papillae can appear from irritation, usually temporary. But here's the warning. A sore or lump that doesn't heal in 2 weeks should always be checked. It could be oral cancer. Your tongue also connects to your overall health. A pale tongue may mean anemia. A smooth tongue can signal iron or vitamin deficiency. A swollen tongue can point to allergies, thyroid issues, or infections. This is why doctors often say, stick out your tongue. It's a simple but powerful diagnostic tool. So what does your tongue say about your health? A healthy tongue is pink and moist, but changes in color, coating, or texture can signal issues, from vitamin deficiencies to infections, and in rare cases, even cancer. The takeaway is simple. Don't ignore your tongue. Check it regularly. It might reveal more than you think. If you found this video helpful, subscribe for more clear, science-based dental and oral health tips.